Welcome to the ANEW Insight Podcast, empowering and inspiring your journey to optimal health. Hosted by Dr. Supatra Tovar, clinical psychologist, registered dietitian, fitness expert, and author of Deprogram Diet Culture. Rethink your relationship with food, heal your mind, and live a diet-free life. I follow my guests' journey to optimal health, providing you with the keys to unlock your own wellness path. Tune in and evolve with us. Welcome back, everyone. We're here for the second half of our conversation with board-certified holistic nurse and health and wellness nurse coach, Samalie Rivera. We've been talking about nervous system health, women's healing, and the importance of reconnection. I can't wait to go deeper. Samalie, welcome back.
Happy to be back.
So let's talk about intuition a little bit. I think a lot of women struggle to trust their intuition because they have spent so many years prioritizing other people's expectations. How can someone start to rebuild that sense of self-trust?
So I'm going to go back to starting off with self-compassion, just learning to love yourself, give yourself loving kindness, but also taking baby steps, because we've been so externally focused and focused on trusting the external world. We've neglected the internal. And a lot of the times, for example, I'll just say you're trying to work on working out and you're like, I'm going to work out on Monday. Monday comes, you don't work out. So you start to break that trust with yourself. So you have to start doing little baby steps to start building that trust within and also connecting within. Because when we tend to want to do the most biggest thing at once, we tend to not follow through. And again, that goes back to breaking the trust. So start off small, even if that's okay. Every morning, I'll wake up and start my day with gratitude. Do a prayer, whatever you want to do to start connecting within. Make it small. And then over time, you build your capacity and you're able to have something that feels amazing.
Yes, I agree. And I really do think the pathway to our wisest, oldest intuitive voice is through our nervous system. And if people can understand that when our nervous system is out of whack, when we are in our sympathetic nervous system, it's really interesting. I do this all the time in my practice. I have people examine the voice that comes out when they're in their sympathetic nervous system. And it's so interesting because they're usually in their most wounded part of themselves, like usually in their childhood. So they're stuck in this wounded child place. And they're also very much up into their cognitive mind. And so what I tend to do is I take them through a nervous system regulation where there's just 2 minutes of deep breathing, or I do something to activate the vagus nerve, and I get them into their parasympathetic nervous system. That's, I think, where our intuitive voice lies. When we're deeper into our bodies, when our mind is a little bit offline and we're more connected, especially like you said before, to our heart and to our gut, it's incredible the voice that tends to come out when they're in that mode. It's like deeper, wiser, calmer, grounded. And then what I like to do is I like to have them then just talk to that wounded part of themselves and give themselves the thing that they need to feel calm and to feel heard and to heal. Amazing work. And I think if everybody could learn how to do this and really deeply tap into their intuition, they would only listen to themselves. They would never listen to anybody else's advice. They would go with whatever felt right for them, and it would always be right. I think that's one of the most important things that we can do. And I love that you do that with people. So let's talk about your work some more, and that it emphasizes embodiment rather than just mindset. Tell us why embodiment is more advantageous than just mindset work? And what are some simple practices people can use to come back into their bodies during a stressful day?
Yes. So, first of all, the mind is very beautiful. I love the mind. I work in psychiatry. Like, I really do admire the mind. However, the mind is very logical, it's very rational, and you cannot get to the same place with your mind you can't get to the same place with the mind like you would with the body because the body has wisdom. And part of that is our intuition. And we've learned to value the mind and just focus on the mind, but the body has its own language. We weren't taught the language of the body, and the body communicates through sensations. And the body actually communicates with you before the mind does. So, say if you got a weird or like strange gut feeling, or your heart is like really fast or just something doesn't feel right, you're like kind of like a bit put off by something. That's your body communicating with you. Even though your mind doesn't logically know what's going on, the body's telling you. And that is when you let the body lead, let you guide you through life to make choices.
Mhm. Well, how can a person do that? Say that they, in the past have kind of, shooed away those thoughts like, oh, he's fine. And then realize that, he's pretty much a complete jerk later on. In a regular stressful day, if someone hears, their body, give them that sensation, that warning sign, what do you suggest that they do instead of pushing it down and pushing it away?
So, what I suggest doing is taking a moment to step aside, in a private place and first tapping into your breath. It always starts off with the breath because you cannot get information from your body when it's dysregulated. You want it from a regulated state. So, regulate your body through your breath. Take a few belly breaths. If it feels good, place one hand on the heart, one on the belly. And ask yourself a simple question such as, body, what do I need to know? And just noticing what comes up through sensations within the body from the top of your head down to the tip of your toes. And no need to judge what's coming up or attaching, just noticing what's coming to the surface for you and making a decision from that more clear, regulated state of mind.
Yes, I recommend this for people who struggle with comfort or emotional eating or mindless eating, that really want to learn how to stop that behavior, but not go into any kind of restriction or dieting or anything like that. And that's what I always suggest to people is that when they get that first, desire for food, and especially if they're coming from an emotional state, if they were to go, deep down into their body to regulate their nervous system and to really ask in that calm place, what do I need? Sometimes they are going to hear food. Sometimes they'll get a picture of that in their mind, but sometimes they'll hear in their mind, "I need a hug. I need a nap. I need to walk away from this person right now. I need to scream. I need to beat on a pillow. I need to go for a walk." You might hear a variety of things when rather than going on autopilot and going, just towards numbing yourself, if you actually address what's actually happening in your body, you'll start to eat when you feel the need for nourishment. You'll start to, you know, gravitate towards things that your body is asking for. You'll start to provide yourself with what you need in that moment, whether it's a hug or a nap or a walk in the park. I just think that it's so important that even during times of stress, we can just take 2 minutes. It's all it takes, just 2 minutes to go and regulate yourself somehow. And then to deeply ask yourself, what do I need right now? And usually the answer is something wonderful and loving and kind for yourself, because that intuitive voice, it's never going to be mean, right? It is
Mhm.
always going to be loving. Sometimes the mind can be really mean, but the body is always loving. And so tuning into that and listening to that is everything. So tell us about the term wild woman. It can feel really powerful to some people, but also unfamiliar and maybe, taboo. What does that archetype represent in today's world?
Yes. So the wild woman. The wild woman, I know the name could be a bit deceiving. However, it's about being your true authentic self and connecting to that wild spirit within that's free, that is sovereign, that is, again, authentic and connected to the heart. And it's untamed, it's a leader, it's creativity. I mean, it is a beautiful, expansive energy of a woman's or even a person's true essence. So it's about being connected to your power. That is what the wild woman is.
Wow. For someone who's, maybe even a little afraid of that, how do you connect to the wild woman? What starts to happen when you see people who are resistant? How do you help them tap into that?
Yeah, so I'm here to meet people where they are. And doing something as simple as looking at yourself in a mirror and telling yourself, like, I love you. So you could start building that connection to yourself because that's what it is. The wild woman is your inner connection to yourself. So it's about taking small steps that are achievable to connect to this person. And if that's looking at yourself and starting to get comfortable with yourself, then I say let's start there.
Yeah. My guess is that maybe, and you can tell me if I'm wrong, that women over maybe 45 or 50 are pretty good at tapping into the wild woman because they stop, caring so much about what the world thinks of them and just start to grasp and do the things that they want to do. Would you agree?
I would agree. Yes. I've noticed that a lot of wiser woman. I say every time I age within a year on my birthday, I'm like another year wiser, another year gracefully aging.
Mm.
And it goes back to, as you age, you get more wiser and you stop caring about what people think.
Yeah.
And just realizing the most important opinion is yourself.
Yes.
And yeah.
So ladies who are like 20 out there, anybody who's out there in their 20s, like the more you can let that go early, the happier you can be. Just you can't please them all. And, everybody at that age, especially, is really primarily thinking about themselves. They're not really thinking about you. So you can just go to town and let your wild woman out. So, in your circles and coaching, you hold space for vulnerability, which I think is so important, and emotional expression. What do you notice? What happens when women finally feel safe enough to be seen without performing or holding it all together?
So, what I see again is women dropping the mask. They are free to be themselves and they are free to be in a community and notice that they are not alone with the hardships that they're going through. You know, things such as perfectionism, not feeling enough, these things, sometimes you feel like, "Oh my gosh, like, I must be the only person feeling this way." But then when you come into these circles, you're like, "Oh, wait, this is actually normal."
Mhm.
So you drop your shoulders, you start to relax more, and then you're able to emotionally express yourself and have that beautiful connection, which is so vital because it doesn't exist enough within this world. I mean, I remember growing up and just seeing women gossip, gossip, gossip. And, it would be challenging to have this sense of trust. So,
Mm.
this is a space for you to be able to express yourself without having to feel fear that you're going to be talked about. You're just being human, and I'm here to hold you.
Yes, I think that actually that gossiping comes from this masculine world that we live in. I think that we're kind of pitted against each other and given the impression that we're competition with each other and that there's limited resources for all. There's a limited guys, there's limited jobs. Once you get into a job, you have to fight for it and you have to, fend off the other women so that you can win. That it couldn't be more false. I think that, that's where actually mindset can come in and help you if you were to adopt a more abundant rather than a scarcity mindset. Really understanding that there's room for everyone and there is no limit to what we can do will help keep us from that kind of competitive atmosphere. And it would be such a wonderful world if we could all look at each other, women especially, as, colleagues, as, companions, as friends, and not competition. We could go so much farther in the world if we work together.
Mm.
So let's transition a little bit to talk about the work that you're doing with ketamine and ECT. How is that going beyond in terms of healthcare? How can those drugs administered safely lead us to greater forms of healing?
Yeah, so ketamine, this is a form of a psychedelic. It was initially used in the field of anesthesia, to help people go under, and it has other uses. However, ketamine in this case of interventional psychiatry is used for treatment resistant depression. So when clients or patients have failed, I believe, to um, antidepressants, they are trialed on or placed on ketamine. And ketamine has, everyone's unique. I say everyone has their own medicine. And ketamine may be a powerful drug for some and not for all, but that's what anything. And
Mhm.
find your medicine. And in terms of ECT, which is electroconvulsive therapy, it's shock therapy. That's also used to help with treatment resistant depression, which is also very powerful. I remember having a patient she had an eating disorder. She was not eating at all to the point where she had to have a G tube. And over time, the ECT helps her, and she actually started eating again. So very
Wow.
powerful.
That's amazing. I would imagine it helps you access maybe, and you can tell me if I'm right or wrong on this, more of the right side of your brain than the left side of your brain, at least for ketamine. I don't know for ECT, but I think if we and there's a really interesting TED talk called "My Stroke of Insight" by Jill Bolt Taylor, and she witnesses her own stroke. She's a neuroscientist, so she studies the brain, and she realizes she's starting to have a stroke on the left side of her brain because she's like, "Oh my gosh, I can't even form words. I can't dial what is a number at this point, right?" And this is where all of that is housed on the left side of her brain, and so her right side of her brain goes online. And what she experiences, thankfully, she calls somebody and they manage to figure out it's her. She can't even talk anymore, so she's obviously alive. But as she's, continuing to experience her stroke, the right side of her brain is opening up. And what she says she experiences is oftentimes what people experience when they're on psychedelics or when they're in a deeply meditative state. She started to feel like she was expansive, that she was connected to the world. She started to experience this kind of feeling of universal love. And
Mm.
so that's what I think starts to happen for people when they go on ketamine. The critical, logical, analytical side of their mind starts to just calm down a little bit. This is what we're conditioned into so much in this world to stay in. But when we let that go offline and we open up, and this is why when you go on a nature walk, you actually go into your right brain. When you're dancing, you're in your right brain. When you're singing, you're in your right brain. If you were to allow yourself to be in your right brain, as much as, or sometimes even more than your left brain, you start to experience that expansiveness and that connection with all. So I love that you are incorporating this. And this is what you know, I've interviewed people who administer ketamine, and have done some research on my own, and I think that it can really help people kind of break out of these locked cycles in their brain. It's really wonderful that you're doing that. And along with that, in healthcare, what do you think is missing from the way we currently approach women's health and well-being?
Yes. So, what I feel like is missing from women's health is having a focus on the impact of a woman's menstrual cycle on their health. With the menstrual cycle, we have 4 phases, and in each of those 4 phases, our energy levels are different. Our hormones are fluctuating differently. Uh, Even just like productivity, it's different. For example, when you are menstruating, that's the perfect time to rest and reflect compared to if you're ovulating. If you want to do like a talk or be on a podcast, do it while you're ovulating because that's when you have the most energy. So, so I think really just being more aware of how our menstrual cycle impacts us would go far because it impacts your mood, from PMS to even something called PMDD, which is premenstrual dysphoria disorder. And
Mhm.
that's like a more severe form of PMS. And it could get to the point of like severe agitation or even to the point of being hospitalized if it's not taken care of.
Mhm.
So, my point is just taking into account a woman's menstrual cycle and its impact.
Yes, and I hope doctors are listening to this. I think a lot of doctors tend to minimize women's symptoms. I think they also tend to label, women as emotional, or even the oldest term, hysterical, which just makes me cringe. I really think that if healthcare can look at women more on an individual basis, not minimize their symptoms, really, be more investigatory, women's health would improve so much more. So we're almost out of time. I can't even believe we're out of time for this half of this podcast. Tell people how they might be able to get a hold of you, work with you, find out more about you. Where can they find you?
Yes, so you could find me on my website, obaitoriwellness.com. Also, I'm on Instagram, somatic period nurse period Sam. And I also have an Oubaitori Wellness Instagram page and Facebook page. You could email me. I will be more than happy to connect and help to make your life better.
Yay. Well, I'm definitely going to follow you and add you to my social media good stream algorithm that I have been curating. And I hope everybody else does as well. Thank you so much, Samalie, for coming in and helping us, especially women, reconnect to this more intuitive side of ourselves, helping us to trust ourselves and really embracing that all of us are unique and different. Thanks for being here.
My pleasure.
And thank you, everyone, for tuning into the ANEW Insight Podcast. I'm really looking forward to the next conversation, and I hope you join me next time. Thanks for tuning into the ANEW Insight Podcast. Please remember, the contents shared on this podcast is for entertainment purposes only and does not constitute medical advice. You can find us anywhere podcasts are streaming, on YouTube at my.anew.insight and at anew-insight.com under the ANEW Insight Podcast tab. And follow us on our socials at my.anew.insight on Facebook, Instagram, TikTok, and Threads for more updates. Tune in next time and evolve with us.